All right, thanks everybody. Sorry for the technical difficulties. For those here in person, welcome. For those here on Zoom, welcome. We've got a little hybrid action here that we had to kind of work through some technical difficulties first, but officially welcome to the first of 5 transition workshops in our transition workshop webinar series. Our theme today is the transition from pediatric to adult medical providers and that all the transition that goes with there. So we've got 2 awesome speakers for you today. First and foremost, I'd like to thank our sponsor, UC Beef, whose generous contributions have made this workshop series and so many of our programs possible. Without further ado, our first speaker here is Dr. Lawrence Freed. He's a pediatric epileptologist at Children's Hospital of Philadelphia, an assistant professor at the University of Pennsylvania. He's a leader in transition of care for the Division of Neurology at CHOP and is on the professional advisory board for our Epilepsy Foundation of Eastern PA. So I'll pass the microphone over to him and we'll kick things off.
So good morning, everybody, and thank you to those who are here in person and those who are joining us on Zoom, and thank you, Andrew, for that introduction. So I'm very excited to have the opportunity to talk with you all about a topic that's very near and dear to my heart, and also one which is very important and relevant to anyone, a patient and family who has epilepsy. It's an uncomfortable topic that we all unfortunately need to make sure we address. So transition of care refers to literally the transition from pediatric care to adult care, and a lot of times nobody wants to leave their pediatric over the years. So the important thing is, are you ready? So I'd like to start off first with a case. And this may be someone you could identify with. Eric's case, Johnny is a made-up patient, but he is a young adult with epilepsy, and he takes a medication that you may be familiar with, racetam or Keppra. He only had 1 seizure in the last year. Last week, and his pediatric neurologist just told to be seen by a, quote, children's doctor. It will be his last one. He needs to find a neurologist. Does this sound familiar? How does this make you feel? And what do you wish you knew? Are you worried that this could happen to you? So what is healthcare transition? So the GOT transition, the process of changing from a pediatric to an adult model of healthcare. The goals of healthcare transition are to improve the ability of youth and young adults to manage their own healthcare and to effectively use healthcare services, and also an organized clinical in pediatric and adult practices to facilitate this process of transition preparation, the actual transfer of care, and into care. The care is another healthcare transition. During childhood, parents usually help with the medical needs. They call for appointments, they fill out the forms, they keep track of the medications, they remind their kids to take their medications. And as the youth get older, it's important to recognize that the medical needs become their own responsibility. Achieving this independence requires an organized transition process to gain independent healthcare skills, prepare for an adult model of care, and ultimately to transfer to those new providers. So the GOT transition has also provided a nice little framework. So there's the discovering, getting a better understanding of how your doctor's office manages the transition process, tracking, preparing, planning, transferring, and completing. And I'm going to walk through each of these steps over the next few minutes just to give you a broad overview. But the main takeaway that I want you to have is that transition is not something that we need to think about when someone is 17 years old and 11 months and 29 days old. We need to start thinking about that when they're actually 14, like earlier, 12 to 14 years of age. And my approach and what I'm trying to work with the Division of Neurology at CHOP is to get our families to start thinking about medical ownership, starting that at a younger age. So maybe at 14, we start to understand what type of epilepsy we have. What are the names of our medications? How many pills do we take? What are the colors of the pills, the doses? and just gradually get the kids to become more independent over time, again, recognizing that we don't want this whole process to start at 18. So discovering. So here we're learning how the doctor's office approaches transition. So when do they actually start thinking about it? What if my doctor is a family medicine doctor who can see me even when I become an adult? These are important questions to wonder about because a family medicine doctor is different from a pediatric neurologist. And in some areas, there are no pediatric neurologists to take care of our kids with epilepsy. And some of you, especially those of you joining us on Zoom, may be in faraway areas where there really is not much access to neurology care. And so it's tracking. You have to make sure that we know our own health information. Like, what is the name of your medication? What is the dose of your medication? What is the name of your condition? Do you have any allergies? What should you even be bringing to your office appointments? And for example, teenagers may not be aware that they need the insurance card, they need some form of payment, and they should also always have questions prepared ahead of time. I think it's very important, and it makes a huge difference. I've seen it firsthand when the teenagers actually have a list of questions prepared that they know what to ask. And it's like, I have one patient in particular who I met when he was 16 and now he's 19. He's in college and he actually comes to the office with a prepared list of questions that he and his mom had worked out beforehand. His mom used to always bring him to the appointments, but now he does it himself and he does a very good job with it. And for me, it's very rewarding to see that. So what do you as parents do now? That's always the hardest question, I think, for parents who have kids who are relatively independently, able to function independently. And it's important to recognize that now is a time where you can take a step back and support your child as they go through this process. Again, thinking about that one child that I just mentioned, that teenager whose mother helps him with the questions ahead of time. But it's also important to plan. So I mentioned, again, we don't want to wait until you're 17 or even 18. We want to start this conversation at a much younger age. So we have to get ready for adult care. So in the eyes of the law, once you turn 18, you are an adult. And so what does that mean? That means that your parents actually no longer have access to your child's medical care. This also means a child must now advocate for themselves, or they need to give permission for their parents to be involved in their health care. Now, I think a lot of you are probably wondering, well, what if my child is not independent or not capable of functioning independently as an adult? And it's very important in those situations to make sure that you have as much legal protection as you can ahead of time. So that being like power of attorney, where applicable, legal guardianship if the child is intellectually impaired. And I actually want to pause for a second because I opened by saying that this particular topic is very near and dear to my heart, because my cousin actually, she may be one of the main reasons I ended up going into the field of epilepsy, pediatric epilepsy. She's a year younger than me, and I will never forget, she developed epilepsy at a young age, but when she was 19, she landed in the emergency room for seizures. And she was she was taken to an adult hospital where they actually would not let my aunt and uncle in the back. And I see a lot of nods in the audience. So I don't know if this is something you've experienced or you're aware of being a possibility of something even happening. And that's like the worst possible scenario for any parent. Like, you've been taking care of your child, you love your child, you want to help them through this, and you're scared too, and you're being told you can't go anywhere near your child. And I have to say that children's hospitals were, by and large, much more accommodating and understanding because we've been taking care of the kids all their lives, but with the parents involved. But adult hospitals, they're working we're all trying to work within the framework of the law, and we do just need to do as much as we can to protect ourselves and make sure that the parents are able to go in the back and are able to help with the decision making, to tell the ER team what medications their kids are taking, the type of epilepsy, et cetera. And so it is very, very important. It's an emotional topic for me. So I'd like to talk about another quick little case. And so Letitia, she takes some sort of pill 2 times a day, seizures, and she can't remember what kind of it was because it's been so long. Neurologist. What should they talk about? She has no medical concern. Can anyone maybe spot any areas where Letitia could improve her knowledge about her medical condition? Well, she takes a white pill. Does anyone know what that white pill is? I sure as heck don't. So that's one important thing to keep in mind. And I can't tell you how many times families will tell me, especially the and the parents will tell me, oh, I take the pill twice a day and the white one once. And you know, it's unfortunate because we as physicians have no idea what the pills look like. And it's not because we don't want to know, but it actually is using to make the generic medications may look a little bit different than the still work just fine, but we have no clue what they actually. And the patient needs to identify, needs to know what it is, track of it, and tell other people. Now, I do also want to say, I mean, this, well, actually, before I'll stop right there. But does anyone have any questions or comments about Letitia or Johnny, or any questions about transition in general at this stage in the game? So recognizing this is the first in a series of talks that we'll be having on the topic. Was any of this surprising to you? All right. Now, is anyone, so when your kids are, in our teenagers, know that they have epilepsy. I'm thinking teenagers, and how do they like a seizure epilepsy bracelet, a medical alert bracelet? Thing that I always talk to my teenagers about. And there's a million different kinds out there on the internet, and you can find very stylish ones. I'm a neurologist, so I have no sense of style, but there's plastic ones, there's metal ones, there's jewelry, but there's actually also, as we're becoming tech friendly, actually have way medical history in your, so that if there's ever, and I'm happy to show people after this presentation, you can actually find it, but I always just recommend that the teenagers, again, who are spending more time on their own, use this. Mm-hmm. Yes, I do. Mm-hmm. If they give, I'm sorry, what? I mean, that's. So can you tell me a little bit more about what specifically you're wondering about?
So I used to work as
a teacher. Mm-hmm. Mm. And I'm sorry to hear that that happened. So what you're touching is a very interesting point, and not every seizure looks the same. And when I have a conversation with families, in particular, like with a first-time diagnosis of seizures, if the kids' seizures don't look like the classic tonic-clonic seizures that we see in the movies, like they don't know what to expect. I mean, seizures can look very different. Some people can have periods of confusion. They can vomit. There's a rare type of epilepsy in pediatrics which is characterized predominantly by vomiting. And so it's entirely possible that, just as you're describing, they just didn't recognize your particular seizure semiology. That's the medical term that we refer to it as. I really can't speak to what the details of what exactly happened, but I'm very sorry that that did happen. And I mean, I'm sorry. So I think I'm very sorry to hear that. And so I wish I had something I could add to that. Unfortunately, obviously, I wasn't part of that conversation, but it is very unfortunate. Really?
Yes.
I'm very sorry to hear that. And I wish that that did not happen. And I would be happy to speak with you privately off this particular forum, but I would be curious to hear a little bit more about what happened with that. But I think as far as coming back to the transition of care for kids and teenagers with epilepsy, I think it's just very important to make sure that not only do we make sure that people can recognize different types of seizures, which is an important point that you're raising here, recognize how to treat them. And I think it's very important to make sure, especially when we have time, like in this last particular case vignette, when we have time in an office visit to talk about transition, like we actually make sure we do it, because unfortunately this is an under, this area I don't feel gets as much attention as other areas do. And I really think it's to the detriment of our patients and families. And I spent the majority of the time talking about what we do for, I'll say, intellectually capable kids, but really there's a whole slew of resources that are available and a whole slew of things that need to be done for our kids and youth who do actually have intellectual disabilities. Many times, like the kids will, just so you're aware, kids will end up staying in school provided care environments or are able to through the age of 21. Parents can and should obtain legal guardianship in certain situations. They can and should consider looking into supplemental Social Security income for the kids who are disabled by their epilepsy or intellectual disability to the point where they cannot work. But again, the important thing to recognize is that there are a lot of different resources that are available, but unfortunately, a lot of times families are not aware of those resources, and I actually end up being the first person to tell them about these things. And so it's it's unfortunate that there's a lack of knowledge out there, but me and my team, we are working very hard on trying to, along with the Epilepsy Foundation, to really develop a curriculum for transition of care, thinking about the medical ownership piece of it, making it a more gradual process from age 14 and up, so that kids and families are well prepared for that transition and transfer to care to the adult model, but also just making sure that they have a sort of a one-stop shop. Like we're developing a website to have all of this information available for families just so they know where to start. And whether you're seen at CHOP or anywhere else, there should always be a team of social workers who can also help. And we actually have some grant funding that's helping us to develop these tools and resources at CHOP. So are there any questions about transition or any transfer of care, any general questions? Well, I'd like to just provide you with a list of some of the resources that I used for today's talk. If there are any questions, I'm happy to chat with anyone offline. But thank you very much.